So I probably do know a lot of faces in the room. So I really wanted to give you an overview of where we are with the vision. First of all, how many of you have heard of the vision, read it? Yeah. So most of you. And the vision has had, I keep saying this, a very long gestation, and it has. It's probably at least a 2-year gestation. But I think that was really important because we had to make sure that it was a real partnership between everybody working in maternity services, but also that we heard the voice of the women. And one of the things that really assisted, and it delayed it, but assisted, is the CUMTAF review. And the CUMTAF review did give us a lot of input from women, but also what the RCOG report had found, and enabled us to just really cross-check that we had everything in place within the vision that was going to give us, hopefully, a really safe and effective maternity service in years to come. So, this is a quote, and thank you, Sue, for going through my life history. But this was a quote I can remember utilising quite a lot when I was putting in bids for things. But actually, Marmot was right. The foundations for health and well-being start in pregnancy. And I know within maternity services, we quite often are the ones to sort of sometimes miss out on funding, and we aren't quite remembered because people think, oh, we need to, early years is about birth onwards, and sometimes midwifery and obstetrics, we have to get in there and say, actually, pregnancy is that time where a lot of the foundations are laid down for that child, but also the public health before it. And I think that was one of the big discussions when we talked about the vision, was actually trying to get from looking at where women are now to actually the potential for the future if public health was better, so that we had a healthier population coming through the front door. Because actually at the moment we know that obesity is high, so we know gestational diabetes is high, we know there's issues around mental health, substance misuse. So actually, what do we want in the future? Do we want women to actually have prepared for pregnancy, to have thought about it? What does that mean? So I actually, within Welsh Government, lead on school nursing as well. And that for me has been brilliant, because a lot of the things that I've thought about, that we need to be preparing children for things like pregnancy, breastfeeding, actually we need to start really early in that child's life. So Marmot's my foundation. I like that. So I just wanted to go through, for anybody who doesn't know the dynamics of Wales and some of the policy, in how the policy in Wales has actually brought together the vision. And one of them is around prudent healthcare. Now, prudent, you can often think, is something that means saving money, stripping things down, making it bare. But actually, prudent is about good use of resources. So it's looking at what we've got and saying, actually, what do we need to provide the best service to women? So one of the things that I'll show later on is the Lancet series, which looked at the majority of women are in that category where they need that foundation care of good midwifery care and may not need to see an obstetrician. But actually, on top of that, you've got the complex women that do need the care of our colleagues, obstetricians, but actually they need to be freed up to be able to give the time to be able to give to those women. So it's about the right women being in the right place at the right time. Reducing inappropriate variation. We're really lucky in Wales that we have got a small country that enables us to work together. And I think we've done that for years. We've now got the Maternity and Neonatal Network, which enables us not just to work together across for maternity, but also with neonatal services as well, which is really important. And I think the fact that we have asked the Maternity and Neonatal Network to actually do the rollout of the vision shows how important it is that they are the system for change that enables people to be brought together so that actually we can deliver the vision. So they will be coordinating those networks to happen to enable the vision to take place. One of the other things that's really important to the development of the vision is the Wellbeing and Future Generations Act, we're one of the only countries that has got this sort of law. And actually, it's really key to making sure that all of our policies are in the right place and that we're valuing families and children at the very core. And that, I know we all say, is a key phrase that whenever I put it in a ministerial speech or something, I think, oh, does it sound twee? But it's about children having the best start in life. And I think we can't not keep saying it. It is about that, and that starts in pregnancy. One of the other things that's really key to a changing population is what we know about adverse childhood events. And we know that these are laid down in not just that child's experience, but also the parental experiences. And in maternity services, we get those key moments where we find out that there's issues going on with that woman's life, that family's life. And actually, if you look at the hierarchy of needs, that's really important that we sort those out. So this morning we heard very much about it's not just the technical skills of our art, but it's actually wider than that. And it's about the social skills and picking up those cues. And within that, things like continuity of care, whether that be obstetric or midwifery, is so important because you get to know that woman and family and you become that trusted professional that they're happy to talk to. Prosperity for All gave us a real opportunity to do something with maternity services. So Prosperity for All was the end of government, so it's the last bit of this government strategy to say what they wanted to do in the rest of their term of government. And I was really lucky. I just got into Welsh Government, and one of the priority areas was early years. So it's made my life very busy because everybody wants to talk to me now, but I never thought we'd be in a place where maternity services was high on everybody's agenda, and whether that be from education to social care, throughout, everybody wants maternity care in there at the very beginning, which is just fantastic. And it shows how government policy can have an impact on practice, which I think from my 35 years in the NHS, I know is really, really true. To one of the other things that came out, which was the parliamentary review, which looked at the quadruple aim. And the one thing that was really key in this was about staff being valued. And I think it was probably one of the first times I'd seen this in any document from a government. But it's part of a Healthier Wales. It was part of the parliamentary review into the government's programme for government. And it's so important. And one of the things in the vision is multi-professional working is a key theme, which I will look at with you now, but also the fact that we need, if we value staff, so it's a bit like that invisible cloak. So if we've got that invisible cloak, actually we care for one another. So we need to make sure that we've got that and that we work together. And the last one on policy, Healthier Wales, which is our programme for NHS and social care for the next 10 years. Really important that we do work across and we do remember our partners, especially in social care. So going back to that hierarchy of needs that we've got to work across. So the evidence for change, there was lots of evidence in the Lancet that showed this foundation, but the women need really high intensive care and what those needs are, but they also need the foundations as well. The fact that in England there'd been the National Maternity Review, which said that up to 45% of women would like to commence their labour in a midwifery-led unit. And then from that, we had the birthplace study that Julia talked about this morning. So all of that evidence and policy behind us. So we started this journey, like I say, a long time ago. But I think it's really important that it was a long time ago because we brought lots of people on the journey. We've had lots of collaborative events. We've had Your Birth We Care. We had a midwife survey. Then we had a survey of obstetricians. All of that going into the pot to say, what do we want to happen? What do we think could happen? And the fact that it's called a vision is because it is a vision for the future. It's a vision for 5 years' time. What the working groups that are starting to work on it are looking at is what are the things that we can do quickly and what are the things that are going to take longer, but that we need to start planning for. That may be in relation to data gathering, it may be in relation to services and buildings. We don't know. But those clinicians are working together with specialists to make sure that we've got the right plan for the future. And I think the fact that it's a vision and it's not based on what we've got now, and that we've tested it and it's what people want. So I'm going to skip through that. That was the engagement events that we had. So the overall aim of the vision, it didn't really change that much, but then actually, probably if you listen to Julia this morning, our aim in midwifery hasn't changed that much, has it? You know, there's always been one goal for us in maternity services, that you're going to have a happy mum, a happy baby, a really good experience and a family opportunity that's going to be that big event in life. So what we said was that pregnancy and childbirth are a safe and positive experience, and parents are supported to give their child the best start in life. I think that positive experience is really important, because sometimes what we consider a positive experience isn't a positive experience for the families. And that's been one of the interesting things, probably working with Cwmtaf Review, is some of those case notes. And I know, going back to when I was consultant midwife, if I've covered the birth choices clinic, quite often you would get a family coming in and you'd look at the notes and think, that's a perfectly normal delivery, you can't say anything wrong, but actually the perspective of the family was completely different. So I think we need to be good at listening and getting feedback from families, so we know what positive is for them. So what are they expecting when they come in, but also what do they feel on the way out? And I think Your Birth We Care actually gave us something really good, and it's something that I would like to see us doing regularly in the future to make sure that we get that overall sense check of where we are. The other thing that we talked about in the overall aim is high-performing multi-professional teams will deliver family-centred care within health boards, which display strong leadership within a culture of research and development, continuous learning, best practice and innovation. Now that is a very long sentence, but actually it's about having that learning organisation that all the time is thinking, are we doing the best? How do we evaluate ourselves? Are we listening to staff? Are we listening to women and families? So all of the time trying to get better. So not sitting at one stage and thinking, we're there, it's fine. So the key themes. So the key themes actually took quite a while to put together, actually. So we had a few events that tested the themes and even the little logos. So the little logos hopefully do sort of tell you what they're about. So the key themes of the vision have now gone into key work streams. So we've got work streams for each of these, or we've got a couple that have been put together. So family-centred care was a key thing that women and families told us in Your Birth We Care. They said, we want to be involved in the planning. We want to know who our named midwife is. We want to know who our obstetrician is. We want to know the evidence base. So this is about us having, going back to those prudent healthcare principles like co-production, so partnership with families, but also with all the other people that are working with them, not just seeing them as a pregnant woman and her family, but actually what's going on otherwise, what's the wider impact for her. Alongside that, and actually we did combine these two to start off with, but I think they're going to break off into different work streams, is continuity of carer. Continuity of carer was a massive talking point. And if we look at our colleagues in other countries, some have gone for full-blown continuity and said, yep, we're going to reach continuity, and some are doing really well on it. We had a very honest discussion about midwifery continuity in Wales. And we actually probably didn't air our dirty linen in public because it was actually behind closed doors, but we decided that we hadn't even got antenatal and postnatal continuity right. And that if we really wanted good family-centred care, we had to work on that first and make that happen. but that we didn't want to lose the intrapartum continuity. We wanted that. I'm a midwife who worked in a changing childbirth team. I know what that feels like, and it was one of the best times in my career. But we need to make sure that it's sustainable. Changing childbirth was never sustainable. So it's got to be sustainable, and we've got to work out a way to do it. Julia's absolutely right. We need research on it. We need to be watching our other colleagues. So I've got, really good links with Scotland, and I'm watching what they're doing, working with the Royal College of Midwives on what are the models of care that are going to give us that. But actually, we're not ready to jump there yet. Let's get antenatal and postnatal continuity right. So the one thing that's written into the continuity of care a bit is that a woman will have a named midwife and a buddy midwife that will provide that care for her antenatally and postnatally. So ideally, every woman should have only 2 midwives for her normal visits antenatally and postnatally. Now, that may mean some changes into how we currently work, set off duty, those sorts of things, but that's for this working team to look at. But that isn't going to stop intrapartum continuity. There will be small pilots of intrapartum continuity in areas, and we've already got them. Powys have got a really good continuity model going. Some of it has to be tested with workforce as well to see how it works with on-call systems, etc. But they're starting. And then when you look at Healthier Wales talks about scaling up projects. So that's what we want to do. We want to scale up projects. That means that everybody in this room, everybody in this building, everybody watching has to be part of that. So if you've got a small idea and you think, actually, I think we could do it in our team, and I've seen several examples of that as I've gone around the country, then talk about doing it, evaluating it, and then the opportunity to scale it up across Wales, which the Maternity and Neonatal Network gives us. How am I doing for time? Safe and effective care. So probably the RCOG report gave us the biggest bit that we wanted to look at with safe and effective care. Probably one of the biggest bits was around data. Data was massive. And I know that I've been doing, every year we do maternity performance boards where health boards come in and they see my boss, Jean White, and me, and we discuss what's going on, what their data looks like, and how they can improve. We've had issues about getting data because the data comes from lots of different systems. So we haven't got one maternity system. We've got several maternity systems. We've got several ways, even though the data definitions we've tried to make as clear as they can be, it depends on what's inputted to what comes out. So we did have lots of apples and pears. We've got less apples and pears now. I would say we've got more just apples. But we're still not in the perfect position. So one of the things that this group is going to look at is, what does a Once for Wales system look like? Is it one maternity system, or is it technology that brings those systems together? But what does it look like? And one of the good things from the RCOG report is it's told us that is really important. You have got to be able to benchmark with other people around you to, one, know where there's best practice so that you can actually learn from that and bring that back to your organisation. But 2, you can know if you're off kilter somewhere. Is there something someone else is doing? Now, I know the Embrace report's about to come out in the next month or so, but that's about something that's happened 2 years ago. That's not about now. So we need to know what's happening now so that we know that our services are safe and effective. The other thing we need to do with safe and effective is make sure we've got a really good system for asking women and families about their care, that they can tell us on the spot what's happening and we can do something about that. And that's not through a complaints process where it's long and they get a written response, but actually it doesn't feedback. We've got to have learning organisations that know about what complaints have come in, what ideas, so that actually you're forever evolving and making things better. The other work stream we've got, and the theme, is skilled multi-professional teams. And we've been really lucky in Wales. We've got Prompt Wales now that has been rolled out across all of the health boards, and it's mandated, so every health board has to do it. We've got things like Obs Cymru that again has been rolled out across Wales. So we've got some really good things, but actually We need to look at both how we skill multi-professional teams pre-reg and post-reg. So what do we do about training together? So do obstetricians and midwives pre-reg train together? Do they do anything obstetric together? Do paramedics work together with maternity services? So it's those sorts of things we've got to think about. But also we've got to think about how we look after one another. So what does that quadruple aim bit mean? So how are we going to care for our staff and make sure that maternity services is what you want to come into? We know there's loads of research out there about burning out. There's loads of talk about 12-hour shifts. All of those things we need to evaluate and say, how do we not only get midwives and obstetricians into the profession, but how do we then keep them there? So attrition with our newly qualified midwives used to be quite high. It's actually improving, but we've got an All Wales preceptorship course that the RCM works with us on. We've now got All Wales recruiting. That means that not only are student midwives recruited earlier before the end of their course, but actually they're then placed for their last placement where they've got their job, so that actually they don't have that big bit from being a newly qualified midwife, from being a student to a newly qualified midwife, that transition is easier. And then preceptorship and things like clinical supervision for midwives provides that support for them ongoing. So we need to make sure that we've got that across the board. And then the last one is sustainable quality services. So I'm hoping that I may well be retired when the next one comes up for review. So hopefully this is the only vision I've got to write with the help of everybody else. But how do we make this sustainable? Wouldn't it be awful in 5 years' time if we say, yeah, we did it, but actually it didn't work? Because that's what happened with changing childbirth. So actually, how can we make this work together, all of us, so that we have got something that we're really proud of in 5 years' time? So planning and implementation, like I say, we've actually got the Maternity and Neonatal Network involved, and I've been through all of those things. And let's be brave. Let's be part of the change. If there's something really wacky that you're thinking of, then actually bring it to the table, because this is the opportunity to have that future vision. Let's just not keep doing the same old thing, because we'll get what you keep doing, you keep getting. So thank you.
Has anyone got any questions? We have a roving mic, I think.
No, they're all silent. Good. Oh.
There's a question.
There has to be one.
Bronglais. I love the vision. I think it's fantastic. But I think you made a really good point about 1993. I remember changing childbirth coming out. So how can we get to the root of the issues that stop us getting to where we want to be? Do you have any ideas?
So I think it's about honesty. And I think we really need to look at the thorny issues. We need to get away from being in rooms and saying what we think people want us to say, and not backing away from those things that are really difficult. So continuity, one of the things that I know the other countries are finding difficult, and in fact I met with the other midwifery leaders last week and we discussed it, and we are going to meet with the Royal College of Midwives to have a conversation about on-call payments and rotas, because actually there's two things with continuity. One of them is about flexible working, and we all still to some extent seem to think we need to clock in and clock out. But then managers maybe also like to know where their staff are. So is it okay for, if you've got a continuity caseload, for you to pop out in the middle of the day and have your hair done? Are you going to be worried about somebody seeing you? So it's about building that flexibility in, and I think we have a new generation of midwives that have got a new way of working. So I think we do need to look at different ways of working and embrace it and not be afraid to put anything on the table. So yeah.
Thank you very much.
Thank you.